East Cooper Medical Center, they know your health, and that includes back troubles. And Dr. Ellen Rame joins us today with how the medical center is treating back pain with minimal invasiveness. How are you, Dr. Ellen?
Good.
It's always good to have you here.
It's great.
Okay, so today we're talking about treating that back pain, but don't always have to think that you have to get a major surgery to treat it. So what are some of the first things that East Cooper is known for doing to kind of get us back to our health?
Right. Well, a lot of the doctors at the Southeastern Spine Institute, we all have privileges at East Cooper.
Yeah.
So a lot of our surgeries are performed at East Cooper. Also, a lot of our injections are also performed at East Cooper. We have a lot of the same capabilities at East Cooper that we also have at our ambulatory surgery center at the Southeastern Spine Institute.
Okay.
So it's a really good, you know, affiliation that we have with them, because when we do have patients that need to spend the night at the hospital, we always have them admitted to East Cooper.
Oh, okay. Well, when we're talking about spinal stenosis, even though it sounds like something that you've probably never heard about before, it's more common than people would think.
That's true. That's true. Very common, especially in elderly patients.
Yeah. So what exactly is spinal stenosis, and then what would you do to treat it?
Well, spinal stenosis is caused by a narrowing around nerve roots or the spinal cord, and can correlate with symptoms such as back pain and leg pain. Yeah. And things that, you know, we can start with more conservative treatments like we usually talk about, with epidurals, and sometimes a lot of people will get better just with several epidurals. However, those that are more have more refractory symptoms or more severe cases, we can do things such as the minimally invasive lumbar decompression, which is called the mild procedure, and that's just an outpatient procedure that actually we only do at East Cooper Medical Center.
Wow.
And then for more, you know, even more severe cases, we have our spine surgeons that all operate at East Cooper Medical Center, and they can do lots of minimally invasive techniques with, you know, small surgeries, small incisions, quick recovery times, and just have a really good relationship with East Cooper. We have neurologic monitoring available, just, you know, state-of-the-art equipment.
Right.
Really nice facility, very professional staff, friendly staff. It's just been a really good relationship.
I can imagine. And what's so great about the partnership that you have with East Cooper, and we're talking about Southeastern Spine as well, you all do very well with all ages. I mean, we talk about this all the time. If you're 20 years old and you're having back problems, if you're 120 years old and you're having back problems, you can get the help that you need, and it's just a phone call away.
Oh, absolutely, yes.
Everything all under one roof. That's what we really like.
Yes, yes.
So, Dr. Ellen, tell us where we can find you as well at Southeastern Spine Institute. Where is that located? Because that's kind of where the consultation starts. Right. And then you move over to East Cooper.
A lot of times that is where it starts, unless sometimes people come into the emergency room at East Cooper, and then we see those patients occasionally too. But East Cooper is on 2000 Hospital Drive, Mount Pleasant, and Southeastern Spine Institute is off of 1106 Chuck Dolly Boulevard. So very close to each other, very convenient. That's
for sure. And so when you talk about East Cooper and the medical side and this, I guess you could say the operating rooms that they have, you just have all of that stuff under one roof. Sometimes people have to get one surgery here, and then they have to wait a couple weeks, and then they get another surgery someplace else because, you know, specialists are in different places. But you all are offering all of that over at East Cooper. Yeah, East Cooper, you know, is just, it's a great facility. It's a new facility. Right. And, you know, they're just trying to stay on the cutting edge and, you know, bring in all the new technologies available to help take the best possible care of patients. There you go. Well, Dr. Ellen, it's always a pleasure to have you here. You know, she's a familiar face because you can see her on Wednesdays when we do Ask Dr. Ellen. We really appreciate you being here. Thank you. Thanks. All right, now on over to